Hi, everyone. My name is John Faulkner. I'm your host of the Smarter Systems, Better Care podcast. And I'm here today with Somer Baburek. She's an innovative healthcare entrepreneur and CEO whose work in diagnostics is transforming how we approach early detection and patient care. Welcome to the podcast.
Thank you for having me. I'm excited to be here today.
Same here as well. Thank you for being on the show. Just to get us off and started, to give us our listeners context, what's the core focus of your business today and how do you serve your clients? Give us a bit of background.
Sure. So Hera Biotech at its core is a precision diagnostics company. We deploy machine learning algorithms in all of our products, and we just choose the best medium for detection. We're focused on conditions that specifically or uniquely impact women. So our lead product is an endometriosis diagnostic. And then we've also got a point of care cervical cancer screening device.
Excellent. So you got a couple different solutions. And then do you primarily work with like hospitals or like who's your direct, how do you work direct to consumer or how does that look?
Sure. So we are an international company. So this question actually depends on which geography we're talking about.
Okay.
Yeah, which makes it a little bit more complicated, but nonetheless, we should all learn more about other countries' healthcare delivery. So in the US, our customer is the payer, right? As it is with everybody.
Mm-hmm.
Our user is the clinician, and the person who experiences our products is the patient. So we have three stakeholders in that sense. In other markets, for example, Mexico, we're in Latin America as well. Our clinicians are both our user and our customer. So it's a little bit different there. We don't do anything direct to consumer. I think if I'm being blunt and candid at the same time, one of the things, women's health is kind of having a moment, if you will. And a lot of people throw around this term femtech and they use it interchangeably. And so whatever your word is for women's health, I'll respect that. But I think that one of the things that we did in the space is, especially during COVID, which is kind of when you started to see women's health get prioritized, we ran to the other end of the spectrum. So we were all kind of operating in a healthcare system that wasn't built by us. We weren't in mind. And the products were basically just smaller versions of what might have worked in a man. And so we ran to the other end of the spectrum and said, how much care and product can we deliver directly to the patient and just cut out this entire system that's been ignoring us all this time, which is a natural response. For us, though, at Hera, we are kind of pulling the pendulum back to the middle and saying, can't write your own prescriptions. You can't diagnose yourself with everything. We should empower you. We should educate you, and you should have products that enable that. But we believe the true win for everybody involved is in the middle. We don't cut the healthcare provider out. We just provide tools where doctor and patient can engage more meaningfully around her healthcare.
And that makes sense. Taking more of it sounds like a team approach is essentially what you're describing, right? Is like
yes,
you understand
exactly.
you want to empower the patient, but to a point, right?
Right, exactly. Yeah. Because at the end of the day, I don't want to trivialize anything, but at the end of the day, you can only go so far with an app, right?
Yes.
And then at some point, you have to say, okay, I have all of this information based on this product that I have in my house. I think I might have X, Y, Z.
Right.
But then where do you go? Because as a patient, you're limited to that. Then you've got to engage a healthcare provider of some sort in order to take the next step to receive a formal diagnosis that goes into your, electronic health record so that you can get, accommodations for whatever that is, or you can get therapeutic intervention, whether that be physical therapy or otherwise. You've got to have a partner on the healthcare side that helps you take the next step to treat, intervene, or change something.
Absolutely. It sounds like you come in as that partner to make that happen, right?
Yeah. So our position, if you will, is that no one's at fault, right? No one's at fault in this equation. Patient's upset because she feels like she's being ignored with her symptoms or what have you, right? However, healthcare provider has nothing. So for example, with endometriosis, which I think is a really, really good analogy for this. Endometriosis, the only way to definitively diagnose this condition is what we lovingly refer to as the Where's Waldo approach to diagnosis, which means you have to have a surgery and the surgeon has to go in and look for the result of the disease growing somewhere in your body, take a sample of that growth, and send it to pathology to have that confirmed that it's endometrial-like tissue growing outside of the uterus. So when you have a patient who's coming in to her gynecologist office saying, I'm having these symptoms, I'm having these symptoms. And by the way, the symptoms of endometriosis aren't specific to endometriosis. They can be a lot of different things because the primary concern is pain with period. Okay, well, that could be a lot of different things, including just she has more painful periods, right? And so, the healthcare provider doesn't have a tool. They don't have anything in their tool belt that they can offer this patient to say, well, let's rule out these three things that could be causing those symptoms that would be problematic, like endometriosis or endometrial cancer or whatever it is, right? They don't have that tool for endometriosis. And so they are at a loss as well. And so what you end up with is what can become a distrustful or adversarial relationship, but it really there isn't anyone at fault. There's a lack of tools to enable meaningful engagement.
Yeah, and that makes sense. It's like, and you kind of alluded to it earlier too, there's like this big push of a swinging from like almost like a corporation with hospitals to like the other end where we're trying to empower women, but to like a point, and then you're trying to provide them with the knowledge, and that not just the knowledge of the patients, but really the clinicians too, and at the time when they need
Exactly.
it, right? So it sounds
Exactly.
like,
And I think it's just, we went wild. Like we went deep during COVID. It was kind of crazy. Like I was
yeah,
having friends send me TikToks or whatever, were like, "Oh, you can remove your own IUD." I was like, no, no, no,
that's a bad idea.
don't
Don't
do
do
that.
that.
It's a trap. This is this is a terrible idea. Like,
Terrible
and
idea. Yeah.
so yeah, so it's kind of that moment of like, okay, guys, like we went a little far. Maybe we should come back in a little bit, rein it in. And it's not to say that women can't do really great and amazing things for themselves, and it's not to say that you can't be your own advocate. But I think the line is you can't do everything. Even physicians, girlfriends who are physicians and gynecologists, they're not removing their own IUDs at home
No.
either, and they've been trained to do this. Like, so, I think that's just an important concept to keep in mind. We can't just jump off the deep end and pretend like everyone is a specialized clinician.
Right. Absolutely. And then like when you look at your role specifically too, like where do you spend most of your energy driving the growth in your business right now?
Well, unfortunately, my primary role right now is fundraiser. Because when you're in a startup, that's what you have to do. You have to raise funds to continue the development. So I'd say the majority of my time is spent fundraising in terms of how I keep the business moving. But really, beyond that piece of it, which is just kind of an obvious thing that every CEO has to do in this space, it's really facilitating meaningful discussions between what might be disparate sections. So, you've got operations who think very much in product, right? Like product. What
Yes.
product are we building? How are we doing this? And what are the milestones that need to be achieved for the product to be ready to launch? And then you've got R&D who's like science for science. Let's do more science,
Yeah.
which is great. And then you've got engineering who's like, no, we could do it again. We can do it again. We can do it again and make it better. And it's like, hang on, everybody. We all need to come
Work together.
together.
Yep.
And all of these things have to happen in concert. And it can be challenging because everybody has very different goals, right? And so that's where I spend the majority of my time. And then on the strategy and vision of how do we execute this? How do we get this into the hands of doctors? How do
Yeah.
we better serve patients in multiple geographies?
Yeah, absolutely. And then just taking a bigger lens, like a step out, looking at the industry as a whole, like market pressures that you're encountering as well. Like what's one shift in your industry that most leaders are not paying enough attention to?
Oh my gosh. Okay. So I have two, but they're in two very different veins. So one of them is on the focus side, specifically as it relates to cervical cancer in the US, which happens to be very ethnocentric. We're just like, oh, forget cervical cancer, forget pap smears. Don't worry about that. HPV. And it's like, you can't treat HPV. You can't cure HPV. You can cure cervical cancer. So what are you looking for? And I think it's a dangerous thing to conflate HPV testing with cervical cancer testing, because you can develop cervical cancer without being positive for the 2 strains of HPV that we test for, right?
Yeah.
And you can have HPV your whole life and never develop cervical cancer. So I think that it's a frightening idea that we're just going to pretend like cervical cancer doesn't exist and we're going to just do HPV testing. I mean, if we've learned nothing from COVID, viruses mutate.
Yes,
So we're
exactly.
testing for 2 strains. So how are you going to understand what's happening? And we hear it from our global partners, right? We're seeing new strains cause cancer here, there, wherever. So I think that's a dangerous trend that I'm really uncomfortable with. And then I think something that people are not paying enough attention to is the pressures on OB-GYN. And it's not good, people. So when you look at the landscape, you've got OB-GYN departments in hospitals, and then you've got private practice OB-GYNs. And a couple of trends are happening. You're seeing PE come into the space and they're scooping up these hospital systems. And they are either completely closing down the OB-GYN department because the margins aren't good, or they're squeezing them like crazy for margins. And OB-GYNs get terrible margins. There's so much literature out there where you can look at the same procedure practiced in OB-GYN that's done for a different indication, and it's reimbursed completely differently, which is ludicrous. And so I think that's really frightening. And so then what happens, you're seeing the same thing in these private practice OB-GYNs. Some PEs are coming in and scooping those up, and it's all about just getting high margin, high margin, high margin. And so OB-GYN care is shrinking. It's drying up. And we've already got OB-GYN deserts. There's 10 million women living in the US that do not have a practicing OB-GYN within
Wow.
an hour of their home. So where are they getting their care, right? And so I think it's something that we really, really need to look at. We need to reimburse OB-GYN procedures better than we do. They are surgeons. Stop it.
Yeah,
I mean,
absolutely.
seriously, people. We need to understand that closing this down isn't helping, because now what you're seeing is concierge OB-GYN go up,
Yes.
which is fine, but it limits access. So for all of the pushes that we have, I think we need to push in multiple directions there. We need to reimburse them better. We need to value that care in a more appropriate manner. And we need to break the trend of just closing things down.
Yeah. And it sounds like there's a lot of pieces to that puzzle for sure that we're trying to navigate. And that was like a very startling statistic. I didn't realize that many women are kind of outside the hour travel time range. That's insane.
Yeah,
So thank you for sharing that for the audience. I appreciate it.
of course.
And then kind of looking back in like your systems and efficiencies, like more internally in your business,
Mhm.
when you look at your operations, like day to day, where do things feel like clunky or kind of slower than you'd like? Is there anything that you encounter from day to day?
I mean,
So much.
so much. Where do I begin? I think a unique challenge that startups and life sciences, I think it may be all startups, but we're talking life sciences, so it's a little different. There are an ample number of tools out there, right, to make things more efficient, and we don't have access to them, right? Because they're too expensive. When you're a startup and you have $0, then you can't do a Monday.com or pick your flavor of project management softwares. You just can't. So you're living in Excel. And if I know anything about systems in workplaces, if you start in one place, moving to a different system is really hard, no matter how much more efficient the new system might be. And so I think it's a really difficult problem. And it is not a super skill to point out problems. The super skill is solving them. I don't have a super skill for this, but I think it's a cautionary tale to founders to understand that building everything on an Excel spreadsheet or a Google sheet or whatever, you have to think about the future and what is it going to take to take that sheet or those sheets, which it will become, and move that into a more sophisticated and efficient system. And the earlier that you can do that, the better. But there's obviously cost constraints on that. And so I think the burden is on the leaders of these companies to really push for early access, lower costs, so that you can work as you scale up and have right-sized solutions, not to say buzzwords.
Yeah. No, that makes sense. I mean, those are very real struggles. And I've heard it in other podcasts as well, is like, it's more like accessibility, I guess is probably the word too, to describe it. So yeah, thank you for bringing that to light to people. They may not be aware of that's it's how it is when you start out, right? So
Yeah.
yeah. And then how are you handling, like, for example, working with potential clients, like, following up like no shows or manual outreach? Is there like
Yeah.
ways you do that, or like in a startup, like kind of enlighten us and how that looks?
Yeah. So hilariously, we had a massive Google sheet for all of our
Yeah.
for all of our potential investor prospects, for kind of our sales pipeline, if you will. We don't have like a sales pipeline, but for what that is to us. And so we recently migrated all of those activities into a system called ClickUp.
Okay.
It was a big ordeal for us to look at all the different options because, there's HubSpot, there's tons and
There's
tons of
so
like
many.
CRM things. The ultimate deciding factor for me was so many of those things are built so CRM heavy
Yes.
that the flexibility to do other things in the system is very difficult. So one of the things we really liked about the software that we chose is it can be used as a CRM. That's not its primary function. Its primary function is project management. So it gave us a lot of flexibility because of like the dashboard view. It looks like little business cards like you'd see in a CRM, but we can also let our engineering team sit over there and run their Gantt charts. And they're so thrilled to be out of a sheet, right?
Yeah.
Like, oh,
Yeah.
we just had to go color code all these boxes again because we changed the timeline, or
Yeah.
whatever it was. And so I think that that's, flexibility in those solutions, because when you're a large company, you can have, and I hear it all the time from my husband, who's in a very large company in the sales organization, and they have like a Salesforce type, right? So it's this big legacy thing. And everyone's like, what the, like it's so huge. And how do
Yeah.
you get what you need out of it? And so there's kind of that like happy medium of you can't be everything to everyone, but depending on which segment you want to serve, I think that if you just allow a little flexibility in how a company can use it, then you're more willing to spend the money on it because it serves your entire organization versus forcing your entire organization to use something that doesn't really serve anyone well.
Yeah. Yeah. That's a good call out too, because there's literally hundreds of tools out there. So the process is overwhelming just to figure out like what the heck do we need to use for us that's useful. So yeah, it's a
Yeah.
decision making and project in itself. So
And
absolutely.
hilariously, my team, like all my engineers gave me a different suggestion.
A
Like,
different
oh, we use, I don't know, whatever it was, Monday or Juno, or I don't even know all the names. And I was like, are these even real? Like, how are there this many platforms to do
Yeah.
one thing? And how do all four of the engineers that work for my company use different ones? Like on your own time, you have your individual free account that you're using. Like,
Yeah.
stop. What are we doing?
Yeah. It can be difficult to manage, and people come from different perspectives too, trying to help out and then
Totally.
make it fit properly. So,
Yeah.
and then,
So in true mom fashion, I just made everybody mad. I didn't use what
yeah,
anybody suggested. I was like, no, you all have to learn a
we're
new
going to use this.
system. Like
Nice.
that's one of the things I'm sure they really love about me.
Of course. You got to have that attitude though in the startup. You just got to make a decision and go
You
for
just
it.
got to
So,
go. Yeah,
yep,
you got to go. As
yep,
they say, fail fast. So you can pivot.
yep, exactly. And then looking at like current results and like bottlenecks, kind of digging like a bit deeper, what's
hmm
working really well that you never would want to lose? Like what's working really well in your business?
Honestly, this is going to sound silly because it doesn't really have anything to do with technology. My team is working really, really
Yeah,
well
yeah,
together, and it's an accomplishment. And I have to go backwards to go forward. So we recently made an acquisition. We've made 3 acquisitions over the course of our 5-year life, and we went from 4 to 12 people. So it was a big jump.
yeah, big jump.
And our company is incredibly diverse. So we're all remote, and we have 3 that sit in the US, we have Canadian, we have Swiss, and we have Mexico. And so not only are we talking about very different disciplines, we're talking about very different cultures and very different time zones and geographies. And so watching them come together and synthesize and harmonize across all of the things that could be hurdles has been really honestly magical to watch. And I see it, like I see them, they're communicating with each other, and you'll watch it on one of our Zoom calls, and one of them is coming at it like very Germanic, very this, very that, and the other one's like very we're on island time. And
Yeah.
then they're like, oh wait, I get it, I get it. And then they like bounce all of a sudden. And then the communication gets far more meaningful and far more engaging. And it's a really neat thing to watch. And it makes me very, very proud of the people that we've brought on, because they're all working their butts off to harmonize across different disciplines, across different indications, and across different cultures. So it's really, that's been one of my favorite things.
Yeah, it sounds like there's a great synergy going on and great energy, which is fantastic to have. And I'm sure it doesn't come without its hurdles. You always probably run into something, but you could grow together, right?
Yes, exactly. Yes. And there's always like, I'm probably the biggest bump for anyone. Like, "Oh, we really need you to do this." I'm like, why do I have to go? I'm not going into that sheet every day. So somebody's going to have to email me to tell me if there's something on that sheet that I need to do. Like,
Yeah.
we're getting there. And I think it's been interesting to see, like, we've recently taken everything over to the Google Drive. And so like the chat function and the ability to like tag each other and things versus just having a bunch of documents floating around in some sort of storage group has been really, really helpful. And watching like the Latin American team who used like Slack and WhatsApp all the time, like get onto chat and get better at chat has been great. So there's been tools that we needed, but I have enjoyed watching it come together.
Absolutely. And then kind of like the alternative to that, like what's been harder than expected despite like all the effort that you put into it?
Fundraising.
Fundraising. Yeah.
Fundraising has been much harder than I expected it to be. I am an incredibly logical and analytical person, like to a fault, probably. I may or may not have been accused of being a robot, maybe by my husband, but it's been a much more difficult and emotional process than I realized. And I think what's frustrating about it is there's not a clear fix. It's a very Lucy and the football environment. And I'm a native Texan. I worked at a VC fund before I started the company, and having to swallow the gigantic pill that my experience in my life up till now is not representative of the experience as a whole, it has been pretty shattering, because I was never a female founder, here. I was always just a CEO. My opinion was always valued, and the progress that I made in other endeavors with the VC fund or the companies that we worked with, that was just face value, right? Very meritocracy. And that is not the case when fundraising, more broadly speaking. Part of the reason that we were able to successfully acquire the cervical cancer device is because the technology was developed and invented in Mexico. It's devalued significantly because of that. Why? It's fantastic technology, much better than anything we have here. So what's the bias, right? And
Yeah,
so
exactly.
it's been really, um, it's been really eye-opening in a very sad way. It's, oh, we don't invest until you have revenue. Okay. And then here's 5 companies that you funded that are not in revenue. And then I'll come back to you with revenue and you'll say, oh, we actually meant 4 million, not 1 million. But you funded 0 revenue. Yeah, but for you, it's different. And they don't say it, right? Like, it's quiet bias, but it's this ever present, like, pass you along. Oh, we love what you're doing. We're so supportive. Put your pom poms down and get your wallet out, boys. Like, let's do this.
Yeah, exactly.
I mean, that's just the long and the short of it. And so I think until there's a really big breakthrough of a fund betting hard on female founders, and the stats are there, we return better returns to our investors, and or technology or founders that don't look like the right founders, I think it's going to be a hard barrier to beat.
Yeah, it sounds like it. Like you said, there's biases that come in, perspectives that are not being, taken well or accepted. I'm sure there's a much more blunt way to say that, but yeah, that can be frustrating for sure. I can imagine, especially when you build something and put all your heart and soul into it, something you really believe in. So
Yeah. And I mean, if you think about it, like I have three daughters. I hate pap smears. I don't know anyone that's like, ooh, yeah, straighten the cervix. Like, no, so our device doesn't require that at all, right? It doesn't require a physical sample. And we've literally had investors say, like, oh, well, then you should just go raise money for that in Mexico. And we're like,
really, wow. Yeah.
I'm sorry, can you just speak into the microphone and play that back one more time? I just want to make sure I got you on it so that we can play that on LinkedIn for you. Because cervical cancer doesn't just live in Mexico. And women in Mexico dying of cervical cancer is no less valuable than women in the US or Europe or Australia or anywhere else in the world dying of cervical cancer, because zero people should die of cervical cancer. It's one of the most curable
Absolutely.
things. So it's that implicit bias, that quiet, sleight of hand it's so gross.
Yeah.
And I'm like, I was a VC. How am I not right for you? I know the ropes. I know how to get these products to market. We've got 12 exits on our team. Like,
That's amazing. Yeah.
yeah, tell me what you're looking for. Cause I can go put on a coat and tie and I'll cut my hair and we can talk about football. I'm from Texas. Let's do it.
Yeah.
Like,
Yeah,
so it's
exactly.
just it's that kind of weird thing that you have to deal with, and no one wants to admit it, and I get it. I wouldn't want to admit it either, but it's something that we have to talk about because we've got to break through.
Yeah, absolutely. And if like just looking at your vision and like your mindset as well, if you're able to solve these major bottlenecks that you're kind of dealing with, with fundraising and working through these things, like what is success going to look like for you in 6 to 12 months?
Yeah, so for us it's going to be making our investors a ridiculous amount of money, which we will. And I think that's amazing. But for me personally, it's going to be knowing that there's a clear path behind me. I want to be the case study, right? So, well, of course you can do this because look, Hera did it. Well, this is their playbook. They did this, and so I equate it a lot to like walking through a jungle, and you don't really know when you're going to break out of the jungle, and you're just hoping that your machete stays sharp enough to
Yeah,
clear the brush in front of you while you get through. And my point is, at least we've left clear path behind us. Whatever that is, there's clearer path behind us so you can at least get to here. And so that's my hope, is that there's a path behind us that's easier. And I'm also very hopeful that I can come back and Sherpa people through. I want to help you too. Like, it's cool that I get out, or that we, are successful in terms of return to our investors and in terms of our product helping patients and improving outcomes. But it's also really important that we reach back and say, there's a lot more work to do. There's a lot more innovation back here. Let's pull it up. Let's get it up here faster.
absolutely. And it kind of brings us to, the end of the podcast. But where can people find you if they want to
Yeah.
connect and have like deeper conversations with you?
Yeah, of course. Well, I am terrible. I'm not on social media other than LinkedIn, but you can find me on LinkedIn, Somer Baburek. And then our company is on all of the platforms, right? So we're most of the time, I think we're LinkedIn and Instagram and Facebook. But then you can also go to our website, herabiotech.com. And there's tons of information there about our product.
Excellent. Well, thank you for joining the podcast and sharing your insights. It was a wonderful conversation. Thank you.
Thank you. Thank you so much for having me.
Absolutely.